Hi, it's Jennifer again here at Indiana State University studying for my BSN or Bachelor's in Nursing and Science. And please note the links to the pre and post test, just a little fun, a little trivia to see what you know about cancer screening, because that's what today's lecture is about, the different screenings for the different types of cancers and when they are recommended to be completed. A pap smear is what checks for cervical cancer, and it's recommended that women have a pap smear at age 25, and then every 3 years for women under 30, every 5 years for women over 30, and every 6 months for women who have a high risk factor for HPV, or the human papillomavirus. And that's why it is recommended that the HPV vaccination be given. Now, there's no need for cervical screening after a woman has had a hysterectomy because there is no cervix to look at. Testicular cancer screening, it's recommended that men do a self-testicle exam at least every month, and it's recommended that you do this after a warm shower. You just hold the penis all the way out and then examine each testicle separately, not both at the same time. Now, the doctor usually checks for this at the yearly exam or earlier if there's symptoms of uneven testicles, pain, or any lumps. And for some reason, Caucasians are at higher risk for testicular cancer. For breast cancer, it is recommended that women do the monthly self-breast exams, preferably right after their menstrual cycle when the breasts are the softest, and for a mammogram every year after the age of 40, and age 25 for women who have a family history of breast cancer. Now, there are women who have dense breasts. That just means that there's not a lot of fatty tissue. So the chances of breast cancer not being seen on a mammogram is 18 times higher for women who have dense breasts. So we suggest that you talk with your doctor about an ultrasound because that can pick up a little bit more than what a mammogram can. And having dense breasts increases the risk for breast cancer. Prostate cancer, the screening is recommended for men over 50 or age 45 for men who have a family history of prostate cancer. The doctor can check the PSA, which is the prostate-specific antigen blood test, to make sure that everything is in the normal range, or they can do a DRE, which is a digital rectal exam. That's where the doctor goes up the backside to feel and see if he feels any abnormalities. And for whatever reason, African Americans have an increased risk of prostate cancer, and also a diet high in animal fats or meat creates a higher risk. So it is recommended that a colonoscopy be started at age 45, which is the current recommendations. It used to be age 50, so this has changed a little bit. So it's always a good idea to check out the Cancer Society website to keep ahead of all of the updated recommendations. Now, through the age of 76, it is recommended for a colonoscopy, but over the age of 76, it's really not recommended at that time. And depending upon the colonoscopy findings, a person may have to return yearly. Maybe they might not have to return till every 5 years, and some people don't have to return for another 10 years. Again, this is going to depend upon the colonoscopy results and any polyps that they find during that colonoscopy. Now, these polyps can be removed before they turn cancerous, but if a person has a lot of polyps, then chances are they are going to have to return in the next year. Or if they don't have any polyps, then they might not have to return for another 10 years. Lung cancer screening, it is recommended that adults 55 and 80 years of age that have a smoking history of more than 30 packs. They get screened for lung cancer, or if they're a current smoker, or if they have quit smoking within the past 15 years, it is still good to check their lungs as well. Endometrial cancer screening. Now, this is recommended after a woman has been through menopause, or yearly if the woman is at high risk and has a family history of endometrial cancer. And screening for endometrial cancer should take place no matter what age if the woman has abnormal bleeding or consistent abdominal pain. And the cancer survivors have a real thing that is called FCR, or fear of cancer recurrence. And some of these patients, they request additional screenings or screenings more often. And yes, after a person is a cancer survivor, screenings more often are definitely recommended, usually every 3 to 6 months. However, people who have FCR, they request it more often than that. And unfortunately, the insurance companies will not pay for additional testing or testing too soon. So this can cause excessive worry. Now, some fear and some worry is normal after having cancer, but if the fear is causing disability in daily functions, then this is definitely a problem and needs to be discussed with a doctor, because this can increase the cortisol levels, which can actually contribute to a more opportune environment for that cancer to return. And it's people with FCR, they're hypersensitive to any body changes whatsoever. Now, there is a particular screening tool for this. It's called the CF Plus, and this is what the doctor uses to understand if the fear of cancer recurrence, or the FCR, is at an anticipated level or at an elevated level. And if it is at an elevated level, then a lot of times it is recommended that they go on to see a counselor or something to help them to not worry so much. So please check the Cancer Society website for recommendations. It is advised that you do this every so often, because as new research emerges, then sometimes the guidelines do change. And so this way you can keep ahead of the guidelines, so that way you don't miss anything. Thank you so much for listening today, and I hope you have a great day. Bye-bye.